Hello, কেমন আছেন? আমি Dr. P. Venkat, surgical oncologist, Apollo Cancer Center, Chennai, India. Breast cancer is one of the commonest cancers which occur in women. It can occur between the age of, the commonest ages occur between the age of 40 to 80 or 90. See, the most common cause of breast cancer is a hormone-dependent cancer. These cancers occur in women where there is excess secretion of estrogen hormones. Again, similarly, this estrogen hormone is also secreted by the fat cells in the body. Obese patients are more common for developing breast cancers. And breast cancer is one of the cancers which can be completely curable. And there are good ways of identifying a breast cancer very, very early. That is by doing what we call the monthly breast self-examination. Any lady above the age of 40 should undergo a monthly breast self-examination, which will be done in front of the mirror once the patient is having a bath, to do a monthly breast self-examination. Second is, any lady above the age of 40 should undergo an annual mammogram. This annual mammogram will, and you need, the most important thing is you need to keep the mammogram reports and films. So when we are doing the next year mammogram, we need to keep the previous year mammograms to have a comparison to see whether there are any changes or not. But breast cancer doesn't develop just overnight. There will be a lot of changes in the breast before they turn into cancer. So whenever we are able to do a mammogram, and we can pick up the breast cancer as a very early situation, and then the chance of cure is extremely high. So again, most of the breast cancers, now around 5 to 10% of breast cancers are also associated with genetics. Family member, let it be the aunt or sister or mother, grandmother who is having breast cancer, chance of the patient developing a breast cancer is very, very high. So you can identify whether the chance of you developing breast cancer is high by doing what is called a genetic testing. So breast cancers can be identified early, and it can be people who are at very high risk can also undergo genetic testing. The genetic testing will give us an idea whether the chance of breast cancer developing is 40% or 60% or what, and things like that. So they require special kind of attention for screening. Next thing is, most of the breast cancers, again, whenever once you find any breast lump when you are doing a breast examination, next thing is you need to meet a doctor. The doctor will examine, then the doctor will do some other test like a mammogram and a biopsy. And once the mammogram biopsy is done, in the biopsy they will do a test called immunohistochemistry. And we need to do another test called PET scan to check if this cancer has spread anywhere else or not. Once you do all this, then we can proceed with the treatment of breast cancer. So if 10 patients come with breast cancer, for all 10 patients the treatment planning is going to be totally different. Breast cancer is just not one disease. It is a spectrum of disease which can be molecularly classified into 4 major types. Again, once a breast cancer develops, so most of the breast cancers require all 3 modalities like surgery, chemo, radiation. All these will be required for most of the breast cancer patients. Again, which to do, whether we need to do operate first, whether we need to do chemotherapy first, depends upon the type of breast cancer. That is why we need to wait for the immunohistochemistry report. Again, earlier days, generally, whenever the patient developed breast cancer, the idea of treatment was going to be completely to remove the breast. Still, most of the patients keep coming and asking, doctor, should we remove the breast? Is it safer? It's better, and things like that. The answer is absolutely no. Nowadays, most of the breast cancer patients, we need not remove the breast. We can completely preserve the breast and do the surgery. Almost 80% of breast cancers need not undergo a removal of the breast. Very less than 10 to 20% only needs to remove the breast. So again, when we do a surgery called breast conservation surgery with what is called a oncoplasty. There are different types of oncoplasties, type 1 and type 2. Say breast cancer surgery is just not one surgery. There are around 30 to 40 different types of surgery. All these are done with the intention of preserving the breast and giving the correct shape to the patient. And again, even if the remaining 10 to 20% of breast cancer patients need to undergo a removal of the breast, immediately we have got what is called the reconstruction of the breast, where we can use the patient's own tissue from the abdomen and do a microvascular surgery and create a new breast. So the idea of treatment of breast cancer is not just curing the patient, is also about giving a good quality of life for the patients. See, whenever the patient's breast is removed, the mindset changes, they go in for depression and kind of a stress and things like that. So by doing reconstruction and doing breast conservation surgery, the entire idea is to make sure the patient does not have the feeling of the breast not being there. Again, this breast conservation surgery is no way inferior to removal of the breast. So most of the patients we need to get to doing a breast conservation surgery. Again, chemotherapies are there. Again, after the surgery, we need to do most of the patients will require chemotherapy, they'll require targeted therapy, they'll require hormone therapy and things like that. Second, the percentage of cure of breast cancers are very, very high, almost to the tune of around 85%, 90% of patients with breast cancer get cured. So breast cancer, there's nothing to get worried or get alarmed and things like that. There are good treatments, a lot of research has gone into it, a lot of protocols have been formed. The treatment is extremely good, and two things: one, the patient can get completely cured. Next thing is the patient breast can be completely preserved.